hold the baby in your arms like this. Obviously you're sitting down. And then you place the bottle in the mouth, and you want to make sure the bottle is up like this. Don't lean it down, okay? Keep it in an upright position. You want to always look at the baby while they're eating. So don't have the baby in your lap and then be watching a movie and be just doing this the whole time. Because that bottle might have slipped out of the mouth, the milk could be drooling all over the baby's face, down the neck. They might be gagging, they might not make any sound, but because the bottle's choking them because you're pushing it in too hard. And you're not paying attention because you're watching the movie. So always sit and watch the baby as you're feeding. Now, if the baby is not it's called latching on when they actually get the bottle and start squeezing. If they're not latching on, it could just be because you haven't angled it right. Sometimes if you rub their cheek a little bit, they'll start sucking better. And then once they start sucking, you just keep the bottle in their mouth. Now, mom might say after a couple of ounces, because there's measurements on the side of the bottle, after a couple, this is a 4-ounce bottle, okay? So a couple of ounces would be 2 ounces. So after half of the bottle is gone, you need to take the bottle out and you need to burp the baby because gas and air builds up in the chest and then it gets uncomfortable for the baby to eat and they might not want to finish the bottle. So you're sitting here, you're feeding the baby. If the baby's awake, you can sing to the baby at this time. You can talk to them. Ooh, is that yummy? You were hungry, huh? You don't just ignore them, okay? This is great one-on-one time with the baby to engage with them. Get them to smile. And then 2 ounces are over. Oh, time to burp. You put the bottle down. And then you can sit the baby up. You just need to have the baby's chin cradled in your hand like this. And then you sit the baby on your leg and you just gently tap the baby's back, okay? That'll bring up the burp. If you want to, you can put the baby up onto your shoulder. Put a burp rag here first. It's called a burp rag. It's like a piece of fabric, okay, like a little towel. You put the baby up on your shoulder. You lean your head against there so the head doesn't flop. And then you just tap the baby's back to bring the burp up. Some babies burp better when they're in an upright position and some burp when they're sitting. Either way, you can ask the mom, which way does the baby like to be burped? In an upright position or sitting? And then say, would you mind showing me how you burp your baby? And then you'll know exactly the way mom wants it to be done and the way baby is going to feel comfortable. Because baby's already unsure of you, or you're a stranger, okay? So if you do everything that mom does, it's going to make it easier, okay? So baby burps. Once the baby burps, you can get the baby's bottle back, and then put the bottle back in, give them the next 2 ounces.